The second type of benign lump and bump that I want to discuss is sebaceous adenomas. Now, sebaceous adenomas are cutaneous warts. They're non-viral, which means they don't go away with a functional immune system. Sebaceous adenomas really are benign tumor. That's kind of a scary word to use, but nothing to worry about here because it's benign. There's no cancer involved. The sebaceous gland, or the oil glands of your dog's skin, can begin overproducing oil, and the skin around the tissue become bigger and bigger. Sebaceous adenomas can become quite big, and you can differentiate sebaceous adenomas from the viral wart papilloma by sebaceous adenomas being oily. Oftentimes when you squeeze them, there's this clear oil that's exuded from the pores. Sometimes there's little tufts of hair coming out of a sebaceous adenoma. Because they do secrete oil, sometimes there's a scab on top. There's some scabbing that can form. Oftentimes they can be a little itchy, so dogs can begin to itch them, which can also allow for self-trauma and secondary scabbing. Sebaceous adenomas are, of course, benign and nothing to worry about. The only time I would ever recommend that you consider removing a sebaceous adenoma if it's growing to the point that, if it's in a location and growing to the point that it's bothersome to the dog. So there again, if it's on an extremity and if the dog will not leave it alone, removing that benign lump or bump may be indicated because your dog's quality of life is dramatically decreased because the amount of licking and chewing they're doing on that sebaceous adenoma. In and of itself, at my practice, I make a note on the body chart, it's a sebaceous adenoma, and leave it alone. I don't recommend that you work the equation backwards, which means some veterinarians will say, my gosh, I don't know what that is. If your veterinarian doesn't know if it's a sebaceous adenoma by just looking at it, by all means, do a fine needle aspirate. Remove some cells with a tiny needle, send it off for evaluation through a pathology service, and they'll be able to tell you, yep, it's a benign sebaceous adenoma, nothing to worry about, leave it alone. What I don't recommend is that your veterinarian say, ooh, I don't know what that is. Let's anesthetize your pet. Remove it before we know what's going on, all to find out it's benign and probably didn't need to come off anyway. The next tumor type that I want to discuss is a meibomian gland adenoma. Now, a meibomian gland adenoma is basically a sebaceous cyst around the eyelid. So meibomian glands are the little tiny glands on the upper and lower lids of dogs. They can happen on cats too, much more frequently noted on dogs. Meibomian gland adenomas are benign and nothing to worry about, but they're actually the most common type of benign tumor that I do remove at my animal hospital. And let me tell you why. Of course, as you know, I don't advocate removing benign lumps and bumps, but meibomian gland adenomas, also called meibomian gland cysts, some people call them eyelid warts or eyelid tumors, benign eyelid tumors. These tumors, although benign, can grow to the size that they can begin to irritate the cornea. So what typically happens is you're looking at your dog, you realize there's a little tiny pinpoint of an eruption on the upper or lower lid. If it stays in eruption, your veterinarian identifies it as not a big deal, a little tiny, it looks like a little whitehead almost, leave it alone. If your veterinarian says, you know what, it's growing, and you're able to note that your dog starts not blinking symmetrically, but starting to blink with that eye more frequently, your dog has recognized that there's something there. If that benign cyst grows to the point that it's rubbing on your dog's cornea, that's when your dog's quality of life can become impaired. In terms of corneal pain is pretty intense, and we do recommend that you remove it, not because it's cancer, but because your dog's quality of life is going to be poor, having to deal with an open wound on its cornea. So surgically removing that eyelid cyst is important. Now, sometimes, to be honest, that's easier said than done. Sometimes these meibomian gland cysts are very tiny when you look at your pet, but down below the lid, they're huge. In those instances, it's really important that you're able to ask your veterinarian if he or she feels confident in removing it, because just snipping off the superficial eruption, the part that you see, won't always cure the problem. You can take off the top part that's visible, but unless you get the meibomian gland, the part of that follicle that's producing oil and some of this inflammation, that eyelid cyst will return. So oftentimes veterinarians will refer these eyelid tumors to an ophthalmologist, a veterinary ophthalmologist or soft tissue surgeon, to be able to do some fancy wedge resections and some eyelid reconstruction to be able to effectively remove the entire benign tumor. Something to think about. In my practice, I don't automatically remove any eyelid tumors. We watch them. In older patients, in fact, I saw a patient yesterday, a 15-year-old golden retriever that has a huge eyelid wart. She is not a candidate for anesthesia. You can tell that it's bothersome to her because she makes a lot of mucus in that eye and she blinks more frequently. What we're doing is we're lubricating that eye with an over-the-counter eye lubricant called Genteel. I'm asking the owner to just keep that cornea well lubricated 3 to 4 times a day with a water-based lubricant that will allow that wart to slide over top of the cornea without creating abrasion or pain. And although removing it would probably be the best choice, she's not a candidate for anesthesia and we're not interested in anesthetizing her for a benign eyelid lump, so we're just lubricating her cornea to improve her quality of life. The next type of benign lump and bump that I want to address is a lipoma. Now, lipomas are benign fatty masses that are incredibly common in dogs. The traditional veterinary community, the non-holistic veterinary community, absolutely will say that there's no breed predisposition, sex or age predisposition for lipomas. And the truth is all dogs can form lipomas, young, old, spayed, neutered, fat, thin. However, holistic veterinarians will absolutely say that we've been able to see a correlation between how big lipomas are and how many lipomas a dog has with their overall vitality status, including the dog's ability to metabolize fat. If your dog does not have ample, adequate, vibrant, thriving metabolism, what tends to happen is dogs tend to lay down fat in glumps. You and I, as people, we lay down, when we gain weight, we gain weight a little bit everywhere. When dogs gain weight, and if they're having inappropriate fat metabolism, they can lay down fat in glumps. And literally, it's a glump of fat, which the medical term is called a lipoma, a benign fatty mass. Animals can lay down these lipomas anywhere in the body. They can be under the skin, they can be in muscle tissue, they can be anywhere. The most common place that you'll be able to feel them on your dog is under the skin. And if they're in the skin, they're movable. You can pick them up and move them around. They're soft and squishy. If they're in a muscle, they're very firm and they can feel like a scary tumor, a cancerous tumor, but they're probably fine. How you know the difference between something scary and something not scary is when you find a mass on your dog, you head to your veterinarian, not an emergency visit, but you ask your veterinarian to determine through a fine needle aspirate if it's something to worry about or something not to worry about at that time. If your veterinarian says, we've done an aspirate, we've looked underneath the microscope, I've double-checked any suspicious cells with the pathologist, it's benign, it's fat, called a lipoma, nothing to worry about. Then we make a note on the body chart of what size it is on the day that you brought it in, and then we just watch that benign tumor for growth. If your dog's lipoma begins to grow, if it's on the move in terms of size, then depending on the location, it may be medically necessary to remove that lipoma before it gets big enough that it can really decrease your pet's quality of life. I can count on one hand the number of lipomas I've removed in my practice in the last 5 years, but those that I have removed, I've done so to dramatically improve the quality of an animal's life. And what I mean by that is this. Some lipomas can remain the size of a golf ball their whole life, nothing to worry about. Just make sure they're not growing or changing, you're not feeling that it's any firmer in consistency, leave them alone. If you have a lipoma, confirmed lipoma, benign mass in the crook of your dog's groin or in their armpit or where their hip joint needs to rotate on the inside, if you begin to notice that that lipoma is on the move and growing bigger, that is something that you may want to discuss with your veterinarian in terms of reducing range of motion or your pet beginning to not use the limb normally in its gait, something that you may want to consider removing when the tumor's smaller rather than bigger. I will tell you that when tumors begin to disrupt an animal's normal movement or their quality of life in general, those tumors are usually pretty big, and your veterinarian is going to make a really large incision, sometimes double the size of the lipoma, to be able to remove all of the fat. Now, it's important to know that when we do remove lipomas, we call it a debulking surgery. Debulking means we get the majority of it, sometimes 95% of the fat. However, with benign fatty tumors, it's very frustrating for veterinarians because even though we can remove all the fat that we can see, there is always some fat cells that remain. Fat cells that are in the fascia, that have slipped down into the musculature, that are on the underside of the skin. Those fat cells have a memory, and unfortunately, lipomas can reform. So we do call it a debulking because we can't promise you that the lipoma will not reform. in that same location. However, if your dog's quality of life is impinged, where the lipoma is really big and your dog's no longer walking comfortably, or it's causing rib cage rotation, or they're compensating in a way that's causing skeletal problems, oftentimes removing that tumor is going to dramatically improve your dog's overall musculoskeletal health, and something that you can consider.